Now, I would like to introduce our first speaker, In-Soon Chen, which we can also call Sam, and he is clinical pharmacist by training. He received his PharmD in 2018 and completed his postgraduate training at Linko Chang Gang Memorial Hospital with a specialization in surgical intensive care. Additionally, he was commissioned as a medical officer in the Marine Corps Intelligence and Renaissance Unit in 2019. Currently, In-Soon is studying bacterial pathogenesis and immune responses in Professor Alice Prince's lab in pediatric infectious diseases at Columbia University, Irving Medical Center, and New York Presbyterian Hospital while pursuing a degree in biological sciences at Columbia. Outside of his academic work, In-Soon is also enthusiastic about public health issues. He has been working with International Pharmaceutical Students Federation since 2019, and he is the chairperson of public health for the 2021-22 mandate. Now, I would like to give the floor to Sam. Sam, floor is yours.
Thank you so much, Mehmet. So I will start sharing my screen, and someone can let me know if they can see the screen. All right, can anyone see the screen?
Yes, we can see your screen. Thank you.
Excellent. All right, let's start. All right, so as Mehmet said, my name is Yingchen Chen. You can call me Sam. I'm the IPSF chairperson of public health for the 2021-2022 mandate. Currently as a research scientist in microbiology and immunology, working for Dr. Prince at Columbia University Urban Medical Center, New York Presbyterian Hospital, specifically in pediatric infectious disease. I completed my training like in 2018, and also finished my postgraduate training at Chavarin Memorial Hospital, specializing in surgical intensive care, critical care, with some kind of military experience and IPSF experience. In terms of conflict of interest, I don't have anything to declare at this moment. All right, so let's see what we can do with this. All right. All right, so today we're going to talk about introduction to advocacy. And as mentioned before, we have finger rules for IPS of the IPSF events. If you want to say yes, you can type Y. If you want to say no, type N. If you have a new idea, type I into the chat. If you have a direct comment, type 2I. If you have any technical issue, type T into the chat. And all of the moderator will come to rescue you. All right, so today's objective. So I hope after today's session, of the participant will achieve functional understanding of advocacy pertaining to the following topics. So the first thing that we are going to talk about is what is advocacy. And the second thing that we want to talk about is a stepwise approach to create an advocacy plan. And lastly, we just to share some kind of insight of advocacy in public health specific to the IPSF Public Health Committee. So, introduction to advocacy. So the first like very important question that we need to ask ourselves is that what is advocacy, right? So like advocacy sounds like a big idea, and everyone is talking about advocacy for this, for that, for things that happened in the past, for things that may happen in the future. So what exactly is advocacy, right? Anyone have any ideas like what advocacy is? If you want to say something, you can raise your hand. If you want, you can also type it in the chat if that is what you prefer. Let's see. Anyone? So what is advocacy? Everyone has been talking about defending a cause. Yeah, might be one of the reason that we one of the definition of advocacy. Deliberating on ideas. Yes, definitely. Advocacy sounds like saying something. Anyone else? Support. Right. Good ideas. Beliefs. Developing our ideas. Supporting. It is a way of delivering a problem. Support. Cool, cool. Very good idea. Influencing decision makers. Strong backing for ideas. Decision making for support of something. And mean to influence decision, development support. Excellent, excellent. So you guys have a lot of good understanding about advocacy. So let's go like kind of delve a little bit backwards to what advocacy means. So advocacy is a it actually comes from like a Latin words, and it's called advocatus, and as like a dated about like 1390, so it's like in the medieval time. So it was specifically saying talking about the office and the position or the function of an advocate. That advocate has like quite a different meaning, and the action or an act of advocating something. So advocate is usually a post or like a office position that to help the king or the lord, whoever was in the power were in the power to defend the cause. And that cause is usually religious. So that means defend the church, defend the religious power, defend for the king. So that's what advocatus means. So like gradually the transition to like French, and now we have this new word called advocacy. So now ad is a prefix that means to, and vocare mean or in modern English called vocate, that means like to call, to say something. So advocacy essentially means you want to say something for something you believe that is right, believe that you have to say, believe that is important. And the current definition is advocacy is an activity by an individual or a group of people that aims to influence decision in terms of like political, economic, and social institution. And so advocacy actually involves like promoting the interest or cause of someone or a group of people. And advocacy is also about helping people to find their own voice. And essentially, there are three types of advocacy. The first thing is self-advocacy. The second thing is individual advocacy, and the third one is system advocacy, which we will focus on a little bit more in today's session because that is more relevant to IPSF work. So self-advocacy. So self-advocacy refers to an individual's ability to effectively communicate, convey, negotiate, or assert his or her own interests, desires, needs, and rights. So a good line like people always say about say on social media all the time is that self-advocacy is speaking up for oneself. So self-advocacy, you can think of this as just like you are the advocate for yourself, and that is self-advocacy. And essentially, this is understanding your strengths, your needs, identify your personal goal, knowing your legal rights and responsibility, and communicate this to the other, and just defend for yourself. The second type of advocacy is individual advocacy. It sounds a little bit similar to the self-advocacy, but it is like by definition is a little bit different. So it concentrates on just one to two individuals, and there are like two types of individual advocacy here. So the first part is the informal advocacy. So when people like your parents, like friends, family members, or agency or like agency in this term were like a law firm or something, and they speak out and advocate for people, vulnerable people. So for lawyers, some of the lawyers will advocate for, like humanitarian lawyer, for example. They advocate for issues that is like within the realm of humanitarian. They speak with people who are at risk of certain of certain danger, and that is kind of like a little bit informal because they are just like skipping up even though in a court it is just like advocating for their like particular interest. And formal advocacy, and it involves organization that pays their staff to advocate for someone or group individual. So like if you think about like a big company like Pfizer, Eli Lilly, this big super big pharma, they will have like a group of legal teams, and and the people within a legal team will defend the rights of the company. For example, uh, the right, the copyright, the color, the usage of the company logo, and essentially a lot of things, like also the registration, the patterns, like a lot of things. So that all of those are considered formal advocacy. And this quote here says that advocacy is having someone to stand beside you if you think someone is unfair, or let someone is treating you badly, and you would like to do something to change it. So self-advocacy is you do the advocacy for yourself. Individual advocacy is, in essence, as finding someone to advocate for yourself. So the last thing, last type of advocacy is system advocacy. So that is like the type of advocacy that we do most often in IPSF. We talk about changing policies, changing laws, rules, regulations that impact how people live their life. And we can also target at a local or like a state, national, international agency, and with a focus of changing law, or a simpler rewrite or write certain targeted or like unwanted policies. So I think this could like kind of capture what we talk about system advocacy, is that what is targeted depends on the type of problem and who has the authority over the problem. And we will talk about in depth about this in the latter slide. All right, let's look at the chat to see if we have some question. All right, so this is a good one. So advocacy is an activity that aims to reach people, informing and influencing them their ideas to be into. Good. All right, standing in for someone or something. Yes, that's correct. Excellent. So let's move on to the second part of the session, which is stepwise approach to advocacy. So how do you do advocacy, right? We mentioned this before. Like if we do like a self advocacy, you speak up for yourself. If you do individual advocacy, you find someone, you pay someone, you find someone to advocate for you. And in the system advocacy, you advocate to change certain policy for like a larger group of people. So okay, we know, like we know this. We want to say something to change something, but how do we do it, right? Does anyone have any ideas how you want to do this, right? Or how, as let's say we have no idea, we just find something that is interesting. Let's say, all right, maybe antimicrobial resistance to a certain in a certain country, or maybe let's say uh, we want to speak up for inequity in health. What can you do? Right? Anyone want to speak for their ideas? Or well, of course, you can also type it into the chat. Let's hear some for you. Anyone wants to speak up? I can give you the floor. Right? Okay. First, define the problem you want to advocate for. Okay, that sounds good. You want to find define the problem. Otherwise, you have no idea what you're advocating for. And let's say Gottman says, I think first we should know the situation where the idea came from, and a way we could make our stand or uh, advocate a firm and sound one. Yeah. Okay. So just want to know kind of the same idea. What kind of evidence do you have? You can make strong arguments. Good. Okay. Before advocacy, I should be relaxed. I should trust myself. Well, definitely. Okay. Make sure you understand the thing you want to advocate, and after defining the problem, define the stakeholder. Good. Good. All right. So we have someone raise their hand. Dua.
Okay, you do advocacy, something like when you want to change some policies, you look about the existing policy and why you want to change this policy and make a report about the impact of your new policy in life.
All right. Good. Good. That's a very good definite kind of process that you want to take for policy work. Uh, like in like in advocacy, but that's more specific to the policy work. Okay. Find out who has the authority to make a decision, drive a mentor to influence their final decision. Yes. Yes. Of you mentioned some good parts of what we are going to talk about in stepwise approach in advocacy. All right. Let's see. So how I would describe is more like um, so how I would describe the stepwise process of advocacy is in terms of research. So in when we talk about research and we have to talk about like design or research, and usually you follow this kind of like 6 step. This is a kind of like very generalized process, but like you see that all the time, especially in the first lecture of research. Uh, when you talk about research. So the first thing is you want to identify research questions, like what you want to research on: antibiotic resistant, heart failure, diabetes mellitus, any kind of disease. You want to form a hypothesis of what is causing the problem, or what might be the treatment, or what might be the prognosis, and you come up with some kind of research plan. You kind of wrap around that hypothesis, and you kind of do your research, collect data, find a patient, and talk to patient, collect the data. Then you kind of analyze the data and kind of evaluate your results. Then you can kind of reach some kind of conclusion, and perhaps like you think this might not be a good enough plan, so you revise your plan, then like you do it again. And this is exactly what we do in advocacy. So in advocacy, we also follow similar approach. The first part we want to do is to identify the question. Then we want to do some research, and it starts with some kind of planning process. And we follow by execution. After the execution, then we want to know like how good is that advocacy. Then we want to do some kind of monitoring. With that, we get some kind of results. We re-evaluate. Then we do revision. So basically, this is research. It's just on the different context. We're advocating for people instead of finding, like exploring and exploring the knowledge and kind of pushing the frontier of science. So the first thing is identify the question, and you can see in the left corner, left down corner, you can see there are like 9 different questions. It's actually this is kind of like a guided question for you to answer yourself. That what kind of like a plan like you want advocacy plan that you can have. So identify a question. You want to identify the key problems. You want to analyze those problems. Then you want to set some goals and objectives for yourself. So the first thing, so the first question you ask for yourself is like, what kind of change do we want to make? Is it talking about health equity? Then perhaps we want to improve access of minority communities to healthcare. We want to maybe lower the drug price, so people from lower socioeconomic classes can have better access to care because we believe healthcare is a human right. So that is kind of the change that you want to make. And the second part of that is research, right? And you want to gather all the information that you get you can get, like and if we put this into research, it will be more like reading a lot of papers, trying to understand how to pinpoint your question, what is the best methodology, and do you want to use like patient with just one disease, or you want to use complex patient? Do you want to do placebo, or do you want to do experimental trial? Like different type of reasons they can get. And for advocacy, you just getting enough information if you want to form a strong argument, and this can include like scientific data that's published on maybe like New England journals, or like JAMA, or like Lancet, those like big high impact journals. You also want to identify key stakeholders, so who are in charge of the change. That can be your local government, that can be your the national government. It can be some kind of interregional like organization, perhaps like the regional office of WHO, or maybe like the UN. And internationally, like for health, is usually WHO. They make the highest level decisions, uh, and of course, our the UN agency can also do that. And perhaps some kind of like non NGOs like IPSF, IPMSA. We can also have like Gavi, COVAX. They're like kind of like an NGO attached to the WHO. They can also make some kind of change. So you want to identify your key stakeholders. And you want to talk about the socio-political aspects. Sometimes you might think this is a good thing to push, but socially speaking or politically speaking, that might not be that feasible. So you might have to work around it. So the question you can ask yourself, including who can allow this change to happen. So you want to find your audience. For IPS, it's usually pharmacy student and recent graduates. And you can also ask yourself what kind of information do they need to change their opinion. So that is so like why like think from the perspective of your audience, like why do we want to make this change? Why do I need to care? That is a very important question. So why do I care? And if you can change that, they start to care, they might change their opinion. And the last question that you can ask is who do they need to hear it from? Sometimes they want to hear it from someone with some kind of equal status to themselves, maybe from their peers, or like their friends, their family. Sometimes they want to hear from someone with higher, like more credentials, like a professor, like a governmental leader, or even religious leaders, perhaps. That can also be in some cases that can also be happening. So the next thing that we want to do is planning. So you want to plan like for advocacy work, it's usually like planning for activities. You want to allocate tasks, like everything come with a price. So you want to also like budget yourself and like plan your time well. Otherwise, it would take forever and takes way too much money. Just like a lot of like construction projects. So question you can that can help you with this part, including how do we get them to hear it. So let us delivery. You can do it online, you can do it in person, you can also um, you can do it through like like an email newsletter, or like a physical newsletter, perhaps, if that is still prevalent in the part uh, in the part that you want to do your advocacy. And a lot of things can work. Like then you want to gather your team. Like this is kind of the human resource. You cannot do the entire advocacy project by yourself, like by your own. Like it is almost impossible to do it, especially when you have a large crowd, large like audience. So you want to identify what kind of task you want to do. Some people want to like kind of draft the note. Some people create the posters, and you want to allocate this task to different people so we can finish everything on time. Then you want to define your budget, how like what kind of budget you have, so you can kind of redefine what kind of activities that you can do. If you want to do a seminar, you want to find a location, then location comes with a price. Then we also have the timeline thing, so everything has to be timed. Like if you talk a lot of people talk about smart go, and I'm not going to repeat myself again. Like everyone already knows smart go. I presume. So like one of the smart goals is you want to be specific and measurable, and the T of the smart means time. So that means everything has to come with a timeline, so you can finish everything on time. All right. So next question is what we got, what kind of resource do we have? We can also talk about what do we need to develop. So maybe we are mixing some. We want to do certain projects that require some money, and we don't have money. Then we have to do some kind of fundraising to bridge that gap, and that's basically what this question is talking about. Next question, the next part is execution. So execution is a no-brainer. Just like whatever you write in the plan, just follow this through and try to carry it out, like just as similar as your plan. So how the first step is how do we begin? What is the first step we should do? And this execution also includes other things including networking. You want to network with your partners, like partner organizations. For IPSF, we partner with a lot of organizations, especially with the World Health Student Alliance, including IPMSA, medical student, IDS, dental students, and IBSA, veterinary students. We'll talk about what kind of policy documents that we can do. For example, if we are at the WHA, then we will probably make some kind of statement to gather the attention, engagement, and it can come with a variety of form. You can engage your stakeholder in person. You can also engage them through online. A lot of our engagement is actually done through online because IPSF is a global global NGO. So a lot of those things can be done through emails or LinkedIn. A lot of different ways we can do it. Right after your execution, and you want to monitor your progress, your results. This include documentation. If you work in research, documentation is very important because you can keep track of the process. That is exactly the same for advocacy. You want to keep track of everything that you do. For example, in the public health, we keep track of all the social media engagement metrics. We read the comments, and we see the suggestions from our contact person, so we can make sure that our work is kind of relevant. You want so that also include the audience reaction in the second part. We also want to track the progress. So engagement it changed day to day. When you publish there's such a material at some certain time, may not be getting that kind of reaction, so you can try some way to boost the engagement. So you want to track that progress to see if your strategy works, and the next time you can just follow the same strategy. And last thing is kind of easy to understand. You want to do revision. So after your monitoring, you have the result that maybe you're not particularly your engagement is not particularly great. What can you do? If the stakeholder is not responding to your call to action, then you want to reevaluate yourself, what is going wrong. Maybe our call to action is not strong enough. It's not relevant to their mission, or it's just we talk to the wrong stakeholder. Yes. So you kind of have to improvise and adapt to new situation as you go, and just based on the result that you got. All right. So this is the stepwise approach, about 6 steps. So similar to research, you identify a question, you do the research, find the information to prepare for your plan. You write out the plan and you execute the plan with kind of monitoring metrics at the end, so you can keep track of the results. And based on those results, you make a revision and you do it again. And advocacy is a really long process, and it might be really frustrating. So it is also important to have passion in advocacy. Right. So that's the second part of advocacy. So do we have any questions? Let's see. Or if anyone wants to ask a question, you can also raise your hand. Oh, that's fine. Let's see. All right, we don't have any questions so far. And I will move on from now, but if you have any question, you can still raise your hand or type it into a chat. I'll answer it when I see them. All right, let's see. Okay, so the next thing is talk about advocacy in public health. So public health is a big topic. Public health is actually meaning talking about the health of the public, and essentially, and this idea actually came from a British physician in the late, I think in the maybe in mid 19th centuries. He's the first guy that kind of discovered the cholera and how it is spread around like the community, and now we know like certain region with uh, locals with some kind of like characteristic are most susceptible to some kind of disease, like in fact communicable disease or like a non-communicable disease. For example, if we're talking about a region with like poor hygienic situation, then we're more likely to get some kind of like some a more infectious disease, maybe like salmonella or maybe like E. coli outbreak, or or maybe more relevant is like COVID. If you don't have a good protection, have a good public health system in place, then they're probably going to have more COVID outbreaks. And chronic disease, like if you don't have like a good monitoring system, then like and you don't have a good diet, then is more likely to have non-communicable disease like heart disease, diabetes, and obesity. Essentially, it's a disease. So you will get a lot of things in public health. So therefore, it is also important for us as a like leading public health advocacy like organization to do advocacy in public health. We want to advocate for people and kind of advocate for our members to be the leaders in the public health. So health advocacy. So this is taken from the research article. So in the medical profession, activities related to ensuring access to care, navigating the system, mobilizing resources, addressing health inequalities, influencing health policy, and creating system of change are known as health advocacy. So that is essentially what we do here. We want to make sure the pharmacists are in the forefront of access. So by having more pharmacy students and recent graduates to represent in the public health, uh, our local communities, like regardless of the level, even as a local, regional, international, people are more likely to access to care. Access to care, and they are more likely to navigate the system because pharmacists are usually more accessible than other healthcare professionals. We can address the health inequalities by like disseminating the information, and we can also influence the policy, not just like put pharmacists in place that can help with vulnerable communities. All right, so there are three pillars for the IPS Public Health Committee. We advocate for pharmacy students and recent graduates through the following approach. The first thing that we do is we organize public health campaigns to raise awareness of critical topics in health and humanitarian. So some of the topics that we have done in the last 5 months, including AMRU Summit. So we advocate for antimicrobial resistance. We also did one on HIV and AIDS. We have done International Volunteer Day, and and recently we just published like the World Cancer Day, and with some kind of follow-up campaigns going on. And so this is some of the topics that we are really interested in. So both in the public health and humanitarian, and we also have a for the future. We think we have some kind of interesting campaign coming up, including women's health and also pandemic and COVID-19 campaign, that just to help people understand what is going on in the world. The next thing that we do is network and collaborate with external partners on projects and to expand our area of work. We really collaborate a lot with our partner last year. We work with WHSA, so we work with medical student, dental student, veterinary students on MRU Summit, and now we're collaborating with dental students on different projects. We collaborated with veterinary students through ISOHA and IPSA during our last WHO EB. So this will expand our area of work. So perhaps in the future we can do more One Health related topic, which is a really important topic in health actually. And we can talk more about oral health, which is something that pharmacists should be aware of, but it is also a topic that is commonly ignored by the pharmacists. Lastly, we participate in public health conferences and discussions at the global, regional, and local level to ensure our voices are heard. So this is the reason why we're participating in all the WHO activities, including the World Health Assembly, WHO Executive Board, or like the informal discussion between the WHO and an SA non-state actor like IPSF. We also collaborated with IPMSA on several statements during the last event. So this is what we do. We try to represent the pharmacy student or recent graduates at the highest level to ensure that we will always be the we are always trying to help with the health issue around the world through pharmacy approach. All right, so some of the PH campaigns that we've done, including the MRU Summit. So this is like the last November, and with HIV, mental health, World Cancer Day. This is like fairly recent, and how we do this is kind of similar to what we talk about in the second part of this session. So we identify the question. So for MRSM, the question is like antimicrobial resistance is a really widespread topic. It's a widespread issue in almost all of the country, regardless of the socioeconomic status. So that's why we do this, and we identify the question. We do the research. We find approach that is more suitable would be like doing seminars. So we invite a lot of experts from the WHO, from other non-state actors, research institutions, to kind of share their ideas of what can be the future, or what approach that we can take at this point to address antimicrobial resistance. And of course, we evaluate the situation, and we kind of know like how people like it, and we have been doing this for 2 years, so that's how we know the second one is doing better than the first one. We also have like the HIV and AIDS, which based on our metrics. It seems like one of the IPS members' favorite top campaign to do in during this mandate. We also starting something interesting, which is like email interview with some kind of expert in the field. So, for example, the mental health campaign, we interviewed a psychiatric pharmacist from the UK, and she talked about like what it's like being a psychiatric pharmacist, what is required to do this job, and what parts of the job she liked the most. And lastly, we also have the conventional campaign like the World Cancer Day. We talk about like certain information that you need to the pharmacists need to know about like cancer, and we're also planning to do some kind of webinar in the future to talk about like more futuristic and more advanced information on cancers. These are like not the full list, but it's just like the list of partners that we work really close with. So of course we work like really closely with the United Nations system, that includes United Nations, World Health Organization, UNESCO is this is more of the PD, so like in the future you can ask more PD about this. And we are also a part of the UN ECOSOC, so that allows us to approach a lot of UN like organization, including the UNEP, so that is the United Nations Environmental Program, like UNICEF, which is the UN organization focused specifically on children and children's health, and that also give access to the United Nations Major Group for Children and Youth, which is we are a steering committee member. And I will be in a meeting to talk about them on specific topic and how pharmacists and pharmacy students and recent graduates can be involved in a certain topic. In terms of the framework of World Health Student Alliance, we have IMSA, IPSA, IAAS, IDS, as I mentioned before. Lastly, we also have some external partners that we work really close with, that include Global Health Workforce Network. So we talk about one of the big topics I talk about is like mobilization of pharmacists internationally. And we also have FIP here, which is like an organization that is kind of an adult version of IPSF, if I can put it that way. We also have IPMA, so that is the industrial part of the pharmacy. We also have Alliance for Health Promotion, and if you follow IPS social media, you will see our chairperson of external relation, Paul. He was the representative at the event, and we also work pretty tightly with the fakes because we don't believe that counterfeit medicine has a place in this world. And in terms of public health conference and discussion, you can see that we are represented at the 150th WHO Executive Board meeting, and before that is the 74th WHA special session on pandemic preparedness. And you can see our president Osama is here. We also invite some extra partner, including IDS, ISOHA, and IBSA. And right now is we are looking for a new delegation for the 75th World Health Assembly. And if you have time, if you are interested to participate in this event, and go to IPS social media and look for the call, fill out the question, and looking forward for your application. Looking forward to you to join us in the future. All right, I guess that is the end of my presentation. And if you have any question, let's see. Do we have any question here?
First of all, thank you very much, Sam, for your amazing presentation, comprehensive contents, and thank you very much for everything. So far, we have one question into the chat box, and I will deliver them if they will write other questions. So our first question is, what is the next step when the idea you're advocating for is getting a negative feedback from the public or audience? And I really like this question. Thank you very much, Moses, for asking this.
All right, that's a good question. So this is specifically talking about the evaluation part. So if we can go to that slide quickly. Right. So let's just talking about like revision and improvisation. When we have saying like negative feedback, depending on what kind of feedback you got, is usually like not easy to know. But if that is just a plain negative feedback with no constructive comments, then we can just ignore it. If they provide some kind of constructive feedback, perhaps your content is not inclusive enough, or perhaps your content is like there's some kind of misinformation, then you can change it. And we can also, like, based on our statistic, we know like certain times that works better, but generally speaking, you spend a long time just develop a kind of baseline, and you can see what kind of the trends and see what is the best for you. It's kind of like research. You always adjust your protocol like a little bit by little bit, and just to try to find the best way for you. I hope that answers your question.
Okay, thank you very much for your answer. And if anyone have any question, you can type into the chat box, or you can type I to take the word, or there's no question so far, or you can just raise your hand and ask it yourself. I think we can wait for a couple minutes. I also would like to remind that after this session, at 4:30 p.m. GMT +0, there's another session will be delivered by Marta Po. So you can just wait in here, or leave this session and can join at 4:30 p.m. GMT +0.
I definitely attend Martha's session. She's an amazing person, and she's one of my best, one of my favorite colleagues in the entire IPSF team. She's very hardworking and she knows a lot. She's also a pharmacy in the US, and she has been working I think she worked as a policy coordinator since the last Monday, so it's like she has a lot of experience.
Yeah, I totally agree with you. I can't wait to attend her session, and I think there are no questions. So if you have any question to Sam, you can also type to educationadvocacy@ipsf.org, and I can ask your question to him. So if you would like to ask a question after the event, you can just reach out to me. I will also write my email here. Okay, Kirby, would you like to ask a question?
Hello.
Hello. If you would like, you can ask your question and Sam can answer. Okay, if you don't have any question, we will have a long break. Actually, we will have a break for 32 minutes, and then at 4:30 p.m. GMT +0, Marta Po will make her presentation, and I look forward to see you also in that presentation.